Hi coders, good morning. First time to see this video in my channel, like, share and subscribe the channel. Already we discussed previous ICD classes is the part 4. Today we discuss very important topic for the sepsis, severe sepsis, septic shock. So last 1 week, 2 weeks ago, many openings for ICC coding. Many interviewers or companies are asked for ICD. So be focused for ICD. Follow my channel and see for previous videos. You got a clarity for ICD. So easy to crack the assessment and interview also. All the best for your future jobs. Okay. Already we small part of previous class is pending. After that, we continue the main topic, sepsis, severe sepsis, septic shock. After completing this video, you got an idea about the sepsis, how to enumerate the questions in assignment, how to write the answer without multiple questions, without MCQs, without options. Some companies put exam without options, and companies follow the MCQs. So anyway, we answer the questions. Okay, infection agents has caused the disease classified of other chapters. So ICD-10 coding rule about how to document infections when the main disease code does not specify the organism. So here the clear breakdown, key idea. Sometimes disease is caused by the infection, but the main code from another chapter, but does not mention the specific organism like bacteria or virus. So in those cases, you must add an extra code to identify the organism. So which extra code to use? You use that code chapter 1 infectious disease, B95 for streptococcus, staphylococcus, enterococcus, B96 for other bacteria, B97 for viral agents. So when do you apply this? When the main diagnosis in another chapter, not chapter 1, and the organism is known but not included in the main code, and the coding instructions say use additional code to identify the organism. For example, pneumonia coded in respiratory chapter caused by the streptococcus. Then main code is pneumonia, additional code from B95 to specify the streptococcus. Important tip, always check for an instructional note under the main disease code like use additional code to identify the infectious agent. That's your signal to add B95 or B97 code. So practice question diagnosis UTI, urinary tract infection due to E. coli. So, main code UTI from urinary system chapter, organisms E. coli, not include the main code. What to do? Add B96 other bacterial agents to specify the E. coli. Practice second question, viral pneumonia due to influenza virus. Main code pneumonia, second organism. So, add B97 viral agent. So, another question, cellulitis caused by the staphylococcus. So, main code is cellulitis organism staphylococcus. What you do? B25 staphylococcus group. So this is tricky question. Tuberculosis of lungs. So here the organism Mycobacterium tuberculosis is already included in the TB code. So no extra B95 or B97 code is needed. Okay. Rule to remember: organism not mentioned in the main code at B95 to B97 series. Organism is already built into the code, no extra code. So, infection resistant to antibiotics. This rule is about the coding antibiotic resistant along with infections. Let's simplify it. Key idea: if patient has an infection that is resistant to antibiotics, you must capture the resistance in coding. This is done using an additional code from the category Z16. So, when to use Z16 codes, use a Z16 resistant to antimicrobial drugs code. So, when antibiotic resistance is documented, for example, drug resistant MRSA, when the main infection code does not already include the resistance, what not to use it? If the infection code already specifies the resistance, then don't add Z16. For example, diagnosis UTI due to E. coli resistant to antibiotics. Main code is UTI, additional code B96 for E. coli, additional code J16 for show resistance. So first you code main code UTI, second E. coli, next resistant to antibiotic. Already they mentioned. So we code first main code, additional code, next additional code. For example, MRSA pneumonia. MRSA means methicillin resistant Staphylococcus aureus. The main code already include in resistance. So no Z16 code is needed. Another example, wound infection, wound infection, drug resistant bacteria, unspecified. So main code is wound infection. Add Z16 since resistance is mentioned but not built into code. Rule remember resistance is maintained, think Z16. Already included in increase, don't add Z16. So first infection code, next then Z16 for resistance. Okay. Next, we move to our main topic sepsis, severe sepsis, and septic shock. These questions, is one or two are questions in your assignment and interview also. So be prepared well on this topic. So I explain step by step, easy way, and also final some MCQs are there. Your answer for easy for understanding this chapter. After completing this chapter, you can get an idea about sepsis. So we move to the next heading. Sepsis, severe sepsis, septic shock. First, sepsis. Basic rule. Sepsis is what? Sepsis means systemic infection. So, yes, sepsis means systemic infection. So, code only the underlying infection. If organism is known, code that infection. If not known, use A41.9. Sepsis unspecified organism. So, first organism is known, use code that first. If not known, A41.9. Do not assign R65.2 for severe sepsis unless clearly documented. So, for example, sepsis due to E. coli. Code sepsis due to E. coli. No R65.2 because not is severe. Severe is not mentioned in this case. Important special note for negative bell culture. Sepsis can still be coded even if culture is negative. So, but query to provide is unclear. Urosepsis, not to valid diagnosis or coding. Do not code it as sepsis automatically. Urosepsis means you don't think this is sepsis. Always query for doctor. For his sepsis is clearly is there or not. So, sepsis and organ dysfunction. If organ failure is caused by sepsis, it becomes severe sepsis. Okay. Organ dysfunction not related. So, if organ failure due to other condition, do not cause severe sepsis. If unclear, query, query to the provider. Okay. So, this is the sepsis. Next, severe sepsis. So, this is where students make mistake. Remember this main three-part rule. You must code first, underline the infection. Example, A41.9 if unsuspected. Next, severe sepsis is R65.2. Code for the organ dysfunction, example, kidney failure, respiratory failure. For example, severe sepsis with acute kidney failure. Simple question. This is severe sepsis. So, first infection code A41.9 is unspecified, R65.2 for severe sepsis. Next, acute kidney failure. So, this is the rule. What is the rule mean? First, you must code the underlying the infection. Second, severe sepsis. Next, organ dysfunction. So golden rule for this. Sepsis, only infection code. Severe sepsis, infection in examination. If they mention in sepsis in question, only infection code is needed. For next, severe sepsis is mentioned. Infection code R65.2 for severe sepsis, organ dysfunction. No organ dysfunction is there, not severe sepsis. Urosepsis is there in question to query, don't go directly. If unclear relationship, always query. So, in exam prep, students often add R65.2 when is not documented, no. Forget the organ dysfunction code, no. Treat urosepsis as sepsis, no. So, perfect. Let's test your exam style mixed questions. Okay. Case 1. Sepsis due to Staphylococcus aureus. What is your answer? So, correct coding is infection code sepsis due to Staphylococcus aureus. He is not mentioned severe sepsis. No need to answer for the R65.2. Organ already included, so no need to add B95. So, this is the exam plan. Second, severe sepsis due to unspecified organism with acute respiratory failure. So severe sepsis is mentioned. So R65.2 could also come. Or there is secondary. Primary is a sepsis is unspecified. Is after severe sepsis due to unspecified organism. So sepsis unspecified organ R41.9. Okay. Next, next severe sepsis or severe sepsis. Next respiratory failure, acute respiratory failure. So, okay. Next, UTA due to E. coli drug resistance. So this is the UTA code also mentioned, E. coli organism, next drug resistance. Next, diagnosis, sepsis with acute kidney failure. Documentation is unclear if related. So query to the provider. Sepsis with acute kidney failure because they cannot assume as a severe sepsis. So case 5, urosepsis. So do not go directly query the provider. So important trap, severe sepsis due to E. coli with acute renal failure. So sepsis due to E. coli, correct code first, or severe sepsis mentioned, so R65.2 next, acute renal failure. So no B96. Why? Because already they mentioned due to E. coli, so no need to take B96. Next, final memory trick, SSO. Source of infection, severe sepsis, organ dysfunction. So some tricky questions we see. Sepsis due to pneumonia. Sepsis due to pneumonia. Organism not specified. So, if not specified, we take R41.9. That is very, very important. So, why? Because reason sepsis is diagnosed. You code systemic infection sepsis, no localized infection. So, severe sepsis with acute liver failure, organism unspecified. So, organism is unspecified. First, you must code A41.9. Severe sepsis is mentioned, so R65.2. Next, liver failure. So, this is the C answer. Okay. Must to include infection, severe sepsis, organ dysfunction. Next, sepsis due to MRSA. MRSA, so sepsis due to MRSA. So, sepsis due to MRSA code only. So MRSA already include organism there is no extra B95 or Z16. So diagnosis sepsis acute kidney failure. So clearly due to dehydration, not sepsis. So A41 unspecified organism kidney failure. So note not severe sepsis because organ dysfunction not related to sepsis. Okay. Severe sepsis due to pneumonia with streptococcus. Severe sepsis due to pneumonia streptococcus. So already they mentioned streptococcus. So B95 code is not from. So this is also wrong. So this is the answer. Sepsis due to streptococcus R65.2 for severe sepsis organism dysfunction. Okay. Okay. Final exam traps to remember this. Don't call pneumonia UTA if sepsis is present. Sepsis takes priority. So don't add R65.2 without organic dysfunction. So don't use B95, B97 if organism are already included. Don't assume urosepsis means sepsis. Ready to the provider. So, next, septic shock. Simplified. What is septic shock? It is a severe form, form of sepsis. Okay. It is a severe form of sepsis. Involves the circulatory failure shock. So, it is considered as a type of acute organ dysfunction. Type of acute organ dysfunction. Coding rule is very, very important. Underlying the systemic infection, exam sepsis code like A41.9, it also specified. Next, severe sepsis also there with septic shock or T81.2 if it's post-dural. Additional codes, the organ dysfunction is present. So, key role, the septic shock can code never the first principal diagnosis. So, first infection, then R65.2. Example, septic shock due to E. coli. So, sepsis due to E. coli, the first, second is septic shock, R65.21. R65.21 for septic shock. R65.2 is the organ infection, dysfunction. 65.21. So, post-operative septic shock. Infection post-dural, post-procedural, T81.12 post-procedural septic shock. So, coding. For example, septic shock with acute renal failure. For infection is the first, second severe septic shock or 65.21 renal failure. So example, don't put R65.21 alone. Don't put the septic shock as principal diagnosis. Don't forget the organ dysfunction code. So easy memory ISO infection septic shock R61.21 T81.12 post procedural or other organ dysfunction. Sequencing for severe sepsis. So severe sepsis R65.2 severe sepsis can never be the principal diagnosis. Okay. Scenario for severe sepsis present on admission, POA. So, if present on administration and qualifies the principal diagnosis, correct sequence underlying the infection, principal diagnosis, R65.2 severe sepsis, organ dysfunction code. So, example, severe sepsis due to pneumonia with acute kidney failure present on admission. So, severe sepsis due to pneumonia with an acute kidney failure present on administration. So, sepsis is the principal, secondary is R65.2, third acute kidney failure. So, so scenario if sepsis is developed during the stay. So, if not present on admission, so underlying the infection is secondary, R65.2 is the secondary, organ dysfunction is the secondary. If presently before administration is there, you are called sepsis of primary. So severe sepsis is developed during the stay. It's not present in administration. If in stay, it develops during stay. During stay, so secondary. So patient admitted for infection later develop severe sepsis. All sepsis related codes secondary diagnosis. So, unclear POAS status. If documentation is unclear whether severe sepsis was present on administration, if documentation is unclear whether severe sepsis was present on admission but query to the provider, special note infection associated hemolytic uremic syndrome HUS, it's severe sepsis, follow the separate guidelines ICD-9. So, 9th chapter, quick memory trick for infection leads R65.2 follows. Infection always first. R65.2 never first. Add organ dysfunction code. So common exam mistakes. What is this? Putting the R65.2 as a principal diagnosis, forgetting the POA versus developed later, missing the organ dysfunction codes, not querying when unclear. So sepsis or severe sepsis with localized infection. When sepsis or severe sepsis is present at administration, if the patient admitted because sepsis or severe sepsis and also has localized infection like pneumonia or cellulitis. So code first the underlying systemic infection sepsis. Code next the localized infection, example pneumonia and cellulitis. If it is severe sepsis, add an additional code subcategory R65.2 severe sepsis as a secondary diagnosis. When sepsis developed after admission. So, if the patient admitted with localized infection first, like pneumonia, when that sepsis or severe sepsis developed later. So, code first the localized infection, next code the sepsis or severe sepsis. So, special case hemolytic uremic syndrome with sepsis follow different guidelines. ICD-9 follow the hemolytic uremic syndrome associated with sepsis. So, what caused in the administration goes first, what developed later code after. For example, sepsis present on administration admission. So, patient admitted with sepsis due to pneumonia. Sepsis A41.9 sepsis on unspecified organism. Secondary pneumonia J18.9. So severe sepsis on admission. So first sepsis code A41.9, second R65.20 severe sepsis without septic shock, localized infection pneumonia. So sepsis developed after admission. Patient admitted pneumonia later developed the sepsis. First you code in pneumonia and sepsis. So sepsis due to post-procedural infection. So documentation of the causal relationship, you can only code at the post-procedural infection if the provider clearly documents that the infection is related to the procedure. So no assumed relations, it must be stated. So sepsis due to post-procedural infection after surgical procedure, wound, surgical site infection. If sepsis due to post-procedural wound infection, first code procedural infection. What is this T81.41 or T81.43? Infection follows the procedure. So T81.41 for other surgical state are obstetric codes O86.00, O86.009. Next, we code the sepsis following a procedure P81.44 or O86.4. So also add the code of the infection of organism. If sepsis is there, R65.2, severe sepsis, add on code auto organ dysfunction if it's present. So after infusion, transfusion, injection, immunization, if infection comes from these, code the complication. So T80.2 infection after infusion, transfusion, injection, or T88.0 infection after immunization. Next, code the therapeutic infection, sepsis is C. Also add severe sepsis organ infection. Post procedural septic shock. So, if the infection leads the septic shock, follow the same steps above then. T81.12 post procedural septic shock. Important rule: do not use R65.1 if septic shock in the case. In this case, use 81.12 instead. Also add codes for the acute organ dysfunction. So key idea for this reminder: complications, procedure related infection first, then sepsis, then severity or 55.2 plus organ dysfunction needed. So we see total synopsis concept. We see for MCQs if you correct the answer for these questions, you got an idea about the sepsis topic. So discuss one by one. A patient develops sepsis due to surgical site infection. After a procedure, what should be coded first? So, sepsis due to surgical site infection after procedure. Why should you code first? So, you also tell always post procedural infection is first, next, then sepsis. So, a patient sepsis following a procedure with acute kidney failure, no organ dysfunction, no septic shock. Septic shock is not, but sepsis following the procedure with the acute kidney failure. So already they mentioned procedure. So procedural infection, sepsis following the procedure R65.2 organ dysfunction. Next include infection T81.4, sepsis following procedure T81.44, R65.2 severe sepsis organ dysfunction. MCQ 3, a patient develop infection after transfusion leading to sepsis. What is the sequencing? So patient develop the infection after transfusion. So after means first with a local infection after transfusion. So post-procedural infection leads the septic shock. Post-procedural leads the septic shock. So post-procedural means T do not use R65.21 T81.12 post-procedural septic shock instead. So provider does not document it, then infection is related to the procedure. Provider is not mentioned. Always assume or don't code any post-procedural complication. Must the provider documents in relationship. So sepsis with non-infectious condition, example trauma and burns. So next is heading. When non-infectious conditions is the main reason for administration, if first non-infection condition, example burn, trauma. Next, infection, sepsis, bad R65.2 severe sepsis, organ dysfunction code is present. So, when infection is the main reason, first infection, sepsis, next non-infectious condition, when both qualify the principal diagnosis, either one can be sequenced first. So, important rule, don't use R65.1 non-infectious series these cases. So, use only R65 code. If severe sepsis are 65.2. So memory tip, cause, injury, burn first. Unless infection is reason for administration. Sepsis in pregnancy with childbirth. Follow the separate obstetric guidelines section IC15. Use zero course obstetric course instead of the standing sequencing. Newborn sepsis follow the newborn specific rule section ICD-16. So different course for system units. So hemolytic uremic syndrome first D59.31 for associated with hemolytic uremic syndrome. Next, underlying the infection sepsis, severe sepsis is present other condition. So memory tip US first, then sepsis. So scenario C. So these are the MCQs. I scroll one by one. After you see answer to the questions. So final memory shortcut is what caused admission is first, complication, procedure infusion is first always, then sepsis, then severity R65.2. Only one R65 code. Special cases override the SGS obstetrics newborn. So another questions also there. See, and for your knowledge purpose, after completing the class, once check these answers. So shortly we discussed roughly what caused admission is first. So sepsis local infection, sepsis on admission, sepsis first. Develops later local infection first. Severe sepsis always add R65.2 and add organ dysfunction code. So septic shock normal case R65.21, post procedural P81.12. So procedural sepsis always complication first. Infusion that sepsis non-infection condition first. Then sepsis use only for special cases. HUS obstructive newborn. So golden rule only one or 65 code, no documentation, no complication coding. Complication always first. So ultramemory complication, sepsis, reality, cause first rule for rapid for sepsis coding. Sepsis, pneumonia. and admission for sepsis. So these questions are there. So see these questions and answers. I hopefully this class here for in examination purpose use. So like, share, subscribe. Thank you.